Thanks for the opportunity of presenting our article, Importance of Reporting Complete Procedures of Identifying Patients from the Danish National Patient Registry, in which we use the neonatal jaundice and epilepsy as examples. The Danish National Patient Registry is a valuable resource for research. It was set up in 1977. The study period of this study is between 1997 and 2016. The data in the registry is organized in tables. The administrative table and the diagnostic table are often used to identify the patients with a diagnosis of interest. The two tables have a common variable, rec number, which is a unique rec number of a hospital contact, and used to link the two tables. Other variables include PNR for patient ID, CDAG for the primary diagnosis of a hospital contact, CDAG for any diagnosis of a hospital contact, CDAG type for the type of a diagnosis. The type of a diagnosis includes A for primary diagnosis, B for secondary diagnosis, H for referral diagnosis, and plus, which indicates the diagnosis has additional information. You can find the additional information in the variable CTDIAG, which we call an associated diagnosis in the study. Researchers often reported the date source and ICD codes in papers. However, the information are not complete. It turned out that the two papers applied two different approaches for the same purpose. Approach 1 identify patients of interest by considering all diagnostic information with exclusion of referral diagnosis only. Approach 2 excluded diagnoses of hospital contact that were coded with a Z code of ICD-10 as the primary diagnosis of the hospital contact. All related diagnoses in the diagnostic table were excluded accordingly. Approach 2 excluded referral diagnosis as well as approach 1. What are Z codes? The Z codes are used for health service on examination and investigation or reproduction, etc. The two approaches identified different proportion of persons with a diagnosis of neonatal jaundice and epilepsy. We explored the potential explanation for the difference of the two approaches, and you can refer to the original paper. The finding suggests researchers should report complete procedures of identifying patients from the Danish National Patient Registry for making research findings reproducible and comparable. We thank authors' contribution to this study and the Independent Research Fund Denmark for supporting this study.